Preparing an infusion site. Before establishing an intravenous infusion, check the healthcare provider's order. Gather your supplies. Ensure patient privacy. Introduce yourself and verify the patient's identity by comparing his name and one other identifier with the information listed in the medication administration record or on the patient's ID band.
Good morning. How are you today?
I'm okay.
My name's Jennifer. I'm going to be helping take care of you. We're going to get an IV started here in a minute. If you wouldn't mind stating your name and your birthday, please.
Then, explain the procedure and determine which arm he prefers you use.
Do you have an arm preference that you'd like?
Right.
Right seems to be okay? Okay.
If needed, raise the bed to a comfortable working height. The patient should be seated or in a recumbent position, and he should be wearing a gown with shoulder snaps, which makes the garment easy to change once the IV is in place. Slip a towel or disposable protective pad under the selected arm, and ensure that your equipment has been arranged nearby on a clean, clutter-free surface.
All right, I'm going to go wash my hands. I'll be right back.
Perform hand hygiene and don gloves. Select the vein into which the vascular access device will be inserted. Veins on the dorsal and ventral surfaces of the arm, such as the cephalic, basilic, and median antebrachial, are preferred in adults. Avoid the veins on the thumb side and ventral or palm side of the wrist because of the potential for causing nerve damage. Dorsal hand veins are fragile in older adults and should be avoided when possible.
All right, we're going to get things started here, all right?
Choose a site that won't limit or impede the patient's activity of daily living, his use of assistive devices, or requirements of any planned procedure. Avoid selecting a vein in an area that's tender or in which the skin is red, infected, or irritated. If the patient has had a stroke, don't choose an extremity affected by paralysis. Avoid the arm if a shunt has been placed. Avoid any site that's distal to a previous venipuncture site or distal to any sclerosed or hardened veins, infiltrate, venous valves, or phlebitic vessels. Don't use the fragile dorsal veins in older adults. If splashing or blood spray is likely, put on a mask, goggles, and face shield. Apply a tourniquet around the patient's arm 4 to 6 inches, or about 10 to 15 centimeters above the proposed IV insertion site. To avoid bruising the skin or occluding the artery, don't apply the tourniquet too tightly. Check for the presence of a radial pulse. You may use a blood pressure cuff in place of a tourniquet. Inflate the cuff to just below the patient's diastolic pressure, or to approximately 50 millimeters of mercury. Remember to use the most distal site in the non-dominant arm if possible. The dominant arm is preferable in renal patients if no other access sites are available. Avoid the forearm veins in renal patients who may require a fistula in the future. Select a well-dilated vein. Use a technique to increase venous distension if necessary, such as placing the extremity in a dependent position and stroking along vein in a distal to proximal direction below the proposed venipuncture site. Another way to increase venous distension is to apply warmth to the extremity for several minutes using a dry heat source. Do not leave the patient while the heat source is in place, and use caution in patients who may not be able to express discomfort. Select a vein large enough for insertion of a vascular access device. With your index finger, palpate the vein by pressing down gently. Note the resilient, soft, bouncy feeling of the vessel as you release the pressure on it. Clip the patient's arm hair with clean scissors or a surgical clipper if necessary. Do not shave hair as microabrasions can increase the risk of infection.
Would you like any topical anesthetic to be used before we start it?
Nah.
Okay, thank you.
To decrease insertion discomfort, a topical or local anesthetic can be administered with a physician's order. Be sure to monitor for allergic reaction. Remove gloves and perform hand hygiene before preparing tubing. Make sure you have the adapter end of the infusion tubing or the short extension set with needleless adapter for the saline lock within reach. It should still be in its packaging. To prepare the IV tubing and solution for continuous infusion, first, check the IV solution to ensure you've observed the 6 rights of medication administration. If you're using a barcode system, swipe the patient's wristband and then scan the bag of IV fluid. Make sure the bag has no leaks. Open the infusion set, maintaining the sterility of both ends of the tubing. Be sure to close the roller clamp. Remove the protective cap from the IV tubing insertion spike. Then, expose the IV solution port without touching the exposed port. This port is located either on the plastic bag or on top of the bottle, depending on how the IV solution is packaged. Then, without touching the spike, insert it into the port. Invert the IV bag or bottle and hang it on the IV pole. Now, compress the drip chamber on the IV tubing and release it, allowing it to fill 1/3 to 1/2 full. Prime or fill the infusion tubing with IV solution. If necessary, remove the protective cap on the distal end of the tubing. Ease the roller clamp open to allow the solution to travel from the drip chamber through the tubing to the needleless adapter. Do not touch the spike or the open end of the bag. Return the roller clamp to the off position after priming it. If you removed the protective cap on the distal end of the infusion tubing, make sure you apply a new cap. Check the tubing to ensure it's clear of air. To remove small bubbles, firmly tap the portion of the tubing in which the bubbles appear. Then, check the entire length of the tubing to ensure that all air has been removed. For how to perform venipuncture, refer to the video skill Performing Venipuncture.